Acne scarring is a condition which can be very, very concerning to many patients. I see people who are well into middle age or even older age who still are very concerned about their acne scarring. One of the reasons that this is the case is that acne occurs in the teen years, when body image concerns are very high in teenagers' minds. And so if a person is concerned and anxious about acne scarring in their teen years, it's something that can carry on with them all of their life. The most important thing, if you have acne, is to be seeing a good physician or dermatologist who's going to treat the acne medically so that you minimize the potential for long-term scarring. Usually the people that I see are people who already have their acne scarring and are then asking how this can be improved. What we really want to improve, first of all, is the color of the scars. And so if there's a bit of pinkness in the area, sometimes it comes down to something as simple as foundation and using a good sunblock to minimize color changes. But the biggest issue with acne scarring is the contour change, usually a depression, but occasionally if there's a little bit of excessive scarring, what we call hypertrophic scarring, then a little bit of elevation of the scar. In this latter case, what we use sometimes is a steroid injection to soften and smoothen and flatten that scar a little bit. But again, the biggest issue is usually a depression. Now the fillers that we've spoken about, hyaluronic acid fillers like Juvederm or Restylane in particular, can be very effective in helping to elevate a scar a little bit. Sometimes we'll do, first of all, what we call a subcision. We use a very fine needle to break the scar up underneath so that we can elevate it a little bit better. In other cases, but not quite so often, we may do a direct surgical excision of a really bad scar. Or sometimes we can do a punch elevation, meaning we use a small round punch to punch out the scar, or at least to help it elevate closer to the contour of the skin. And finally, we sometimes will use laser resurfacing with the carbon dioxide laser in order to lower the surrounding skin a little bit closer to the deeper contour of the scar to get an overall improvement. The important thing to recognize is that we can almost always get some improvement in acne scarring. But it's also very important to recognize that we can almost never get as much improvement as we might like, and we can never remove it completely. So realistic expectations are really critical in treating patients with acne scars so that we can be sure that we're going to get a result that will be satisfying and at the same time be accepting in the sense that it may not be perfect, but just much improved.